Welcome and thank you for joining us for the very first episode of Mofeed-19. I am Hesham Sallam. I'm joined by my co-host, the man widely known as Amr Hamzawy, but whose real name is really Amr Hamzawy. We are having a discussion today about how the COVID-19 pandemic has been perceived in the Arab world. We are pleased to welcome our guest today, Professor of Politics at Princeton University and co-principal investigator of the Arab Barometer project, Amaney Jamal. Amaney, welcome. Thank you for joining us.
Thank you. It's a real pleasure to be with you, Hesham and Amr.
Amaney, how has public opinion in the Arab world responded to the COVID-19 pandemic, and what are their attitudes towards their government's handling of that crisis?
Yeah, no, that's a wonderful question, Hesham. What we find in the Arab Barometer data is some variation across countries in terms of how people assess the challenge, the crisis of COVID. So, for example, you take a country like Algeria, and another country like Jordan, where the public really felt that the COVID virus was, or pandemic was posing a serious challenge to the countries, versus another country like Lebanon or Tunisia, where they already were suffering economic crisis. They weren't really prioritizing that the COVID was posing that much of an additional crisis. So again, there was a lot of variation across the countries, depending on, I think, where each of the countries was economically to begin with. Because Tunisia and Lebanon were already suffering economic crisis, they placed less of a priority of the challenge on COVID, whereas countries like Algeria and Jordan felt that COVID posed more serious challenges.
What did you guys find as surprising patterns in terms of public opinion trends? Public opinion response to COVID-19, as well as to its social economic challenges, public health challenges, and maybe vaccination policies.
Wonderful, Amr. So what I found most surprising is that in some countries, like the variation we witnessed in the United States, some people were taking the COVID crisis a lot more seriously than others. So among the people who were not concerned about the COVID virus, for example, in Iraq, 43% of those who were not concerned basically said it was because that the COVID virus was being exaggerated. So again, we have some of that fake news, nobody take the virus seriously sort of mantra also infiltrating the Middle East. In Jordan, about 34% who weren't concerned were also saying that it's exaggerated. So again, this effect of maybe fake news on social media seem to have some effect in the region. Some of the other surprising results, in my opinion, is that there is a lot of hesitancy about the vaccines. About 63% of Tunisians said that they were hesitant about taking the vaccine and maybe are very unlikely or somewhat unlikely not to take the vaccine. In Iraq, about 62% expressed, so this is a majority opinion. Algeria, 53% expressed this opinion. Jordan, 51%. So almost in four of the seven countries we surveyed, you have majority of the population saying that they were going to think twice about taking the vaccine. Only in Morocco, Libya, and Lebanon, the numbers are in Lebanon 30%, Libya 27%, and Morocco 11%. So in Morocco, you have like sort of the highest compliance with the vaccination. That was very surprising. Also, what was very surprising about that, Amr and Hesham, is that oftentimes, especially when we work on the Middle East, on the Arab world, we often say, well, it's all about levels of education. It's the less educated who will not take. Believe it or not, we find very little variation across education groups on this question. So in other words, in Iraq, it's the high educated versus the lower educated are just as likely to say this response. A similar story is in Tunisia, in Algeria. In Jordan, we do see education matters slightly. Lebanon, education matters slightly, but no effect in Libya or Morocco. So again, this is not necessarily being driven by levels of education. So there is this general concern in the public, which if you ask my analysis on this, Amr and Hesham, if I can just get ahead, I think this is where the public health campaigns need to be much more effective. In terms of reaching an audience, which I think this speaks to more of the health infrastructure in many of the countries. And my last point about a surprising finding, Amr and Hesham, I believe the COVID crisis helped several Arab regimes And what do I mean by that? It helped the authoritarian project, if you may. What do I mean by that? I mean two things. One, when we track levels of confidence in existing political institutions before and after COVID, what we see is that more citizens felt, especially the citizens who felt that their countries did a good job in combating COVID, we saw that their levels of confidence grew in the government. The second dimension of this is something that we're tracking. We find roughly, this is like a rough estimate across all countries, about a third of the populations basically saying that the regimes should have more powers to monitor citizens, tracing them, contact and tracing wise, that citizen freedom should be curtailed in terms of movement, expression of speech, and censorship because of to allow governments more effectively to combat COVID. So again, this idea that citizens are willing to give up their human rights because of the public health pandemic. So if you look at those two dimensions of this, I believe this further helps authoritarian regimes with the authoritarian reversals in many countries, but also sort of enjoy popular support as they're doing that.
So, Amaney, if I can follow up on your last point, are citizens in Arab countries interested in transparency? Do citizens trust official statistics? I mean, do citizens regard official statistics as transparent? Do they value transparency as an important deed for Arab governments to stick to, or is it sidelined as well?
When we ask people about corruption and transparency in the Middle East, the vast majority of citizens believe that there is a very high percentage of corruption and the lack of transparency in the MENA. So this is sort of conventional wisdom. I would say 70+% in every country believes that there is a lack of transparency and high levels of corruption in their countries. So how has COVID helped, if you may, Arab regimes? It seems that Arab citizens are more willing to turn a blind eye to some of the civil rights abuses in the wake of trying to get the pandemic under control. I do want to say, Amir, just on this, in terms of the pandemic, when we asked people why they were most affected by the pandemic, they said that because they had a family relative or someone, a member of their family who was sick or was affected by the disease. So it's a very personal story for citizens. But when we ask them, well, what's the thing that the government now needs to do the most, Amr and Hesham, after the pandemic, they say the governments need to create jobs because of the economic impact of the COVID crisis. So again, as I sort of talk about, well, you know, sometimes when we talk about Arab citizens willing to give up human rights, there's this tendency to want to link it always to democratic orientations, democratic values. And if citizens are willing to do away with their civil liberties, sometimes the conclusion is drawn that, well, it's because Arab publics still don't enjoy a democratic political culture. I don't believe that. You know, I think if you've seen anything from the Arab Spring, we see that there's a very vibrant and healthy political culture in the region. I think people are economically beholden to their regimes right now. I mean, the only options they have to look towards for better economic futures are the regimes. So, and because of this, they're willing to do away with some of their liberties and freedoms. If I may list the freedoms that we asked about specifically, Ahmed, we asked them whether or not they found it acceptable for the governments to curtail their civil liberties during a public health emergency like the COVID pandemic. We asked about limiting freedom of speech, censoring the media, limit freedom of movement, and monitor and trace citizens' locations. I would say in Jordan, we find most support for this. And Morocco and Tunisia, we find also second and third, very high support. And that also sort of maps onto the economic crisis. Lebanon comes in fifth there as well. And so this sort of tells us, Ahmed and Hesham, you know, how dependent and reliant citizens are on the regimes for economic change, economic prosperity moving forward. But it also tells us that the COVID crisis or at least sort of reinforced this idea that citizens have nowhere to turn to except to their regimes for help and assistance.
Really, I wonder if the data shows any interesting variation across countries that have experienced civil strife, or like Yemen and Syria, as well as countries that have also experienced deep governance crises like Lebanon and Iraq versus the rest of the Arab world.
So we were not able to conduct this in Yemen just because of the infrastructure of trying, randomizing phone surveys and whatnot. Having said that, Hesham, your question is spot on in terms of when we look at some of the crisis countries. I mean, some of the three key crisis countries at the eve of the COVID pandemic were Iraq, Tunisia, and Lebanon, where we saw a lot of protests and at least a lot of economic struggles, right? Again, increasing percentages of the Tunisian population at the eve of COVID are very concerned about the economic conditions. The decade after the Arab Spring has not been kind economically to Tunisians. In fact, more Tunisians say they were better off under Ben Ali than they are today. Lebanon, as you know, has just been a catastrophe. Iraq, we've seen serious protests in the last year, of course, also in Algeria. But when we ask the question about how satisfied are you with your government, the lowest percentages are in Iraq, Tunisia, and Lebanon. Only 4% is satisfied in Lebanon, only 19% in Tunisia, and 24%, about a quarter, in Iraq. When we ask them to evaluate the government performance on COVID, you'll see that in each country, especially these three crisis countries, you see a bump. So that's why I say that the crisis helped these governments. So in Tunisia, while only 19% are satisfied with government, 31% believe the government did a good job. In Lebanon, 4% are satisfied with the government, but 16% believe the government did a good job. Only in Iraq is probably one of the few countries, probably the only country, where a quarter of the population was satisfied with the government, but only 6% of the population is satisfied with how the government handled COVID. And that's perhaps because of there was some laxness in the early stages of the pandemic spread. But those three countries are the least satisfied with the government responses to COVID as well. So although there was a bump in terms of improvement of the valuation, they're still on the bottom three countries on the list.
Amaney, if I can take you back to the point regarding vaccine reluctancy, and you said variation in levels of education do not explain vaccine reluctancy. What would explain vaccine reluctancy according to your data?
I mean, this is a great question, Ahmed, and it's one that I've been looking into because I'm surprised myself about this. And one of the things I looked at just before the podcast is, well, is it gendered, right? Do we see maybe it's about men versus women? I'm not seeing any key differences on gender either across the countries. So I'm looking at the data right now. We just ran it actually early this morning. This is the new data that we're getting back from the field. The genders, it's not really breaking down on gender. And what I'd like to look at is whether Facebook and Facebook access is mediating some of these responses. I think a lot of the fake news is on Facebook. I wouldn't be surprised if we found some results there. And so that's why we're not seeing the difference on education, Ahmed.
On this point, Amaney, are you expecting changes in citizens' perceptions of governments and government performance to be long-term phenomena, or are citizens moving between positive and negative responses depending on what governments do in terms of combating the pandemic, in terms of a vaccine rollout, and how social and economic challenges related to COVID-19 are being tackled?
So this is a really interesting question. My sense is that as the economic consequences of COVID really sort of try to settle in, we know that economies across the region have been devastated by the pandemic, and we already had very high unemployment rates all across the region, very high youth unemployment rates, and so this is going to compound these problems. If governments cannot respond, I think it's going to really hurt these governments, especially the governments who are already in crises. Having said that, Ahmed, what we did with these we did ask questions on government evaluations over 3 time periods, from September 2020 to March 2021. And then in middle October 2020. So we tried to follow this idea. What I can tell you is that in Jordan, although citizens were happy with the response of COVID immediately, after COVID spread, we did begin to see a decline among Jordanians. The only country where we're seeing satisfaction levels continue to rise is Morocco. And remember, Morocco is the one country that is also most likely to take the vaccine, which this is, again, getting us maybe at state capacity and their public health response to the pandemic. I wouldn't be surprised if that's the case. I mean, everybody has sort of cited Morocco as doing much better on COVID than other countries. But it also became much more authoritarian to tackle some of the COVID-related issues. So my thinking is that this is sort of, maybe these are like temporary honeymoon periods for the regimes. It depends. What's also going to be interesting to see, Ahmed, will regimes in these windows have adopted policies that will continue after the COVID crisis?
Right.
Thank you, Amaney. How does socioeconomic status impact people's perception of the pandemic in the Arab world?
Among the poor citizens in the region, they are documenting the harmful impacts of COVID a lot more than, let's say, more affluent. And it's obvious, but I do want to say, like a country like Jordan, at the beginning of the pandemic, about 61% said they were very concerned about COVID, but among the poor citizens of Jordan, that number is closer to 83%. So there's like almost a 20 percentage point spread. In countries where you already have growing inequalities, and where the poor people are finding it very, very difficult to find jobs and adequate employment, this is going to further exacerbate inequalities. It's putting poor people at disadvantages. They are also more likely to have less access to the public healthcare systems. As you know, the public healthcare systems are not as robust as the private healthcare systems in the region. So, you know, one of the things we should keep our eye on as social scientists moving forward is like, what type of inequalities will this produce in our societies? It's something that is very concerning. And of course, of displaced refugees who don't really have access to either public or private healthcare systems sometimes. So, you know, as we think about sources of grievances and sources of protest in the future, not to always, like, you know, be forecasting instability, but there are a lot of ingredients on the ground because of the pandemic that tell us that the grievance structures are more robust, and it's something that we're going to keep our eye on in future years.
And this brings us to the end of our episode. Thank you for joining us today, Amaney. This was Mofeed-19. We will see you next time.